Welcome to the Pitt County Board of Health meeting, February 2014. At this time, I'd like to call the meeting to order. If there's any public comments, and I do not believe we have any, item on the agenda is the physical report. John, you want to go over the physical report?
Thank you, Mr. Chairman. You do have the January 31st financials. We are 7 months into our fiscal year. As the report shows, our current budget is $9.478 million. 7/12 of that is in the pro rata column, which is a little bit over $5.5 million. As of January 31st, we have taken in $5,162,000. As always, we have some timing items on the revenue side to match up our revenue with our expenditures. And I'd just like to briefly just take a moment to go over some of those. The Medicaid revenue, as you see, we've brought in $368,600. The $52,895 in the timing column is the remittance for two particular programs for our January expenses that we did not receive until February. So I'm to true up revenue with expenditures, I'm adding that. I've put in our pro rata portion of our anticipated Medicaid cost settlement number. We budgeted $441,000 for our Medicaid cost settlement. We normally do not receive that until late in the fiscal year, usually May or June. So I have put in the timing column 7/12 of that with the anticipation that we'll get the full amount. But we got significantly more than that last year. I just wanted to be conservative and just do the pro rata section of our budget. As you can see, clinic fees are trailing slightly above our pro rata projection. Environmental health fees are slightly below. That's not a surprise given the weather we've had in the last few months, and typically we get those fees a little heavily more weighted in the spring and summer months. DHHS revenue is a remittance of expenditures, so the fact that that is about $199,000 under budget is a reflection of our expenditures, and those grant programs are also under budget, so that's kind of a wash. County funding, the county in January transferred the full third quarter dollars to the health department, so I've really backed out 2 months of the county funding. The other line is grant-funded reimbursements, and the item in the timing column there is just the timing of revenue and expenditures. We didn't book all of the revenue related to some of those grant-funded expenditures in January. They'll get booked in February or in the previous month. So if you match up, we've got, including the timing items, just under $5 million in revenue and about $5,098,000 in expenditures. So we're looking at a deficit right now of about $138,500. That's pretty much where we would expect to be, with one caveat. As I've mentioned in previous meetings, we just started, because of the new Medicaid reimbursement system, NC Tracks, we just started receiving Medicaid revenue in December, and now we're receiving obviously every month Medicaid revenue, but we're still playing catch up with the Medicaid revenue side. We have one person in our business office who is pretty much fully devoted to settling those claims, researching any denials we're getting, and we're getting a significant amount of denials, most likely because of the new system. Don't quite have all the glitches worked out, but we've got one person who's pretty much dedicated to that. So my goal is, and our goal is to get that $170,000 of Medicaid shortfall closer to zero by the end of the year. Hopefully we'll do that. Other than that, we still do have some issues in our billing. We need more man hours in our billing office to process all of the claims. So we're trying to allocate more resources there whenever we can. It's tough to do with limited staffing. So that's the financial report. I'll be glad to try and answer any questions you may have.
The denials that you're receiving, are you typically successful on resubmission, or?
Yes, yeah, we are. Sometimes we have to resubmit them more than once, though. But it's somewhat of an art and somewhat of a science. So but it really is just a matter of throwing more people hours at the project.
Is this typical for other health departments? Have you,
I think with the new NC track system, a lot of health departments are digging out of the same mess. You know, some private providers have actually sued Medicaid, North Carolina Medicaid, for lack of payment. And we went, 5 months without receiving any Medicaid dollars. So that was just a matter of getting it working for us. So before I finish the report, I do have, and in your packet, I gave you a printout of 3 other grants that the health department administers. Our positive parenting program, and that's about $110,000 budget, or currently it will go up. And you can see the revenue versus the expenditures there. All of these grants, and there's 2 more. There's the the Community Transformation Grant, and then what we call BSEP Lite, which is our breast and cervical cancer control program, which is funded by Vidant Medical Center Foundation. All of these grants, while the revenue and the expenditures are not matching up now, all of that is related to timing of revenue. So at the end of the year, the revenue will equal the expenditures. But when you add up these 3 grants, that's about another $700,000 of activities that the health department staff are overseeing, working very diligently. The Community Transformation Grant is a 9-county grant. So even though it is not in the formal health department budget, it does fall under the health department house, if you will. And the reason they're separated is county finance would prefer them to be that way. It helps when they report their percentage of fund balance versus expenditures. It helps in that percentage, which helps in their bond ratings. So I just wanted to get that to you. I normally don't present that, but it's past mid-year, and I just wanted the board to be aware of that. We will have very shortly another one of these off-book grants, so to speak, and that will be another positive parenting program, but this one will be funded not by NACCHO, but by Department of Public Health, North Carolina Department of Public Health. So.
thank you, John. Any further questions? I need a motion to approve the physical report.
So moved.
Need a second.
Second.
All in favor?
Aye.
Aye.
Opposed? Physical report's passed. Let's go back. Go
I
ahead.
would like, I do have in your packet the budget calendar for this upcoming fiscal year.
I saw
and I
that.
just wanted to get that in front of you. The budget is due to the county manager on March the 3rd, which is right around the corner. So I have my work cut out for me. We will present that budget to the Board of Health at our April meeting. I'm sorry, at our March meeting for your review. At that point in time, based on your recommendations, your guidance, we can update that budget as you see fit. We will then, during the week of April 14th and 17th, I think on April the 17th, Dr. Morrow and I are scheduled to meet with the county manager to go over this budget. Shortly after that, the county manager will typically come back and tell us, well, hey, this is what you're requesting. This is what I'm going to recommend. Sometimes they're very close. Sometimes they're not very close. In our April meeting, in our May Board of Health meeting, then we will bring that manager's recommended budget back to this board for your review. So it's kind of an iterative process. as it is every year. I think it is June the 3rd will be the public hearing on the county's budget. Typically, on June the 3rd, they would adopt the budget. If they cannot reach agreement, a consensus on June the 3rd, they have another date, June the 16th, where they will come back, hold another public hearing, and adopt a budget. So we have a lot of work to do between now and March the 3rd, and then even a lot more work to do after the manager gives us his input. But, we'll all work together and we'll all get it done.
Thank you, John.
Thank you.
Next item, the minutes from last month's Board of Health meeting for January 14th, 2014. I'd like everybody to review the minutes. If there's any questions or updates, please let me know. Otherwise, I need a motion to approve the minutes from last board meeting.
So moved.
Second.
I have a motion and a second. Any further discussion? All in favor?
Aye.
Opposed? The minutes from last month has passed. Next item on the agenda is a e-cigarette letter to restaurants. Dr. Morrow, you might want to go over this.
Yeah, thank you, Mr. Chairman. I just thought that some of our viewing audience may not realize that the Board of Health meets on untelevised dates also between these televised meetings. So this is an issue of old business that has come up over the last couple of months. We talked about it at our other meetings that electronic cigarettes or e-cigarettes are growing rapidly in popularity, particularly among teenagers. They're becoming very popular. There are a lot of different brands. There are a lot of different ingredients. There are a lot of different models, if you will, of this product that are being sold, including right here in Pitt County. The U.S. Food and Drug Administration has planned to regulate these devices as tobacco products, and we were expecting, we've been expecting that action from the federal government for some time now, but it has yet to happen. So in the meantime, states and cities and counties and municipalities across the country have been enacting laws and rules and policies to control these devices because, number one, we really don't, because they're not regulated, we don't know a lot about them in terms of the ingredients. Some of the studies have revealed that there are toxic substances in some of these products, but the chemicals that are in them basically are unknown, and they don't release the ingredients of those chemicals because they're not regulated. Also, the vapor that comes off these products has been found to contain hazardous chemicals that collect on surfaces and potentially pose a risk to both humans and animals. So at your direction, I drafted this letter that we planned to would send out to the restaurant owners and managers. We've had calls from or questions from restaurant managers about whether they could ask people not to use these products in their restaurants. And the answer is yes, that they can. And this letter just addresses that. And if you'd like, I'll read the letter, Mr. Chairman.
Feel free. That way the public will hear it.
Okay. This is addressed to restaurant owners and managers. It says, thank you for your help in protecting the public's health by restricting smoking in your facility. The North Carolina Smoke-Free Restaurant and Bars Law has been in effect since 2010, and we have already seen significant improvements in disease such as the decreased number of emergency room visits by North Carolinians experiencing heart attacks. The sale of electronic cigarettes has recently increased significantly in the United States. There are many questions about the safety of these devices, and there are currently scientific studies being done to answer these questions. the U.S. Food and Drug Administration, FDA, announced its intention to regulate e-cigarettes as tobacco products, but these regulations have not yet been issued. In September of 2013, top law enforcement officials from 41 states, including North Carolina, urged the FDA to promptly issue these regulations. Because electronic cigarettes are not currently regulated, the ingredients of the chemicals they use are mostly unknown, as are the health effects caused by them. It is known that exhaled vapor from some of these e-cigarettes contains hazardous chemicals and particles that can collect on surfaces and potentially pose a risk to humans and pets. As the owner-manager of your restaurant, you have the legal authority to not allow people to use these e-devices on your property. Until more information is available about the safety and health effects of these chemicals on your other patrons and your staff, the Pitt County Board of Health would encourage you to prohibit the use of e-cigarettes or any similar devices.
Okay. Appreciate your information. We need a motion to, action item or motion to send this letter to the restaurant owners.
So moved.
Second.
I got a motion and a second. Is there any further discussions, or I think it's pretty clear, but, okay, all in favor of sending this letter to the e-cigarettes for the letter to the restaurant owners? All in favor?
Aye.
Opposed? Motion approved. Thank you.
Thanks, sir.
The other item on the agenda, tobacco-free parks resolution draft. Do you want to go over that one too?
Yes, sir.
Okay.
This is another item of old business that we had discussed. As you know, a lot of counties across the state are addressing the issue of tobacco use in areas like parks and recreation areas. We've already made all our school properties tobacco-free, but this is a draft of a resolution. Rather than taking this action without surveying our community, at your request, I've drafted this resolution to send out. I've had some informal conversations with Parks and Rec staff in the county, and they are very interested in this. So the resolution I bring before you tonight has had some input from them. I've also consulted with the State Division of Public Health Tobacco Control Branch in bringing this draft to you tonight. So this would be sent out to all the municipalities in the county, particularly to their Parks and Rec staff, as well as other community organizations that are interested in promoting health in Pitt County. So this would just, I think, build support for the Board of Health taking further action. I just remind you that action that if the Board of Health were to pass this as a rule, a Board of Health rule, it would include all the municipalities, so it would include potentially could include all the parks in the county, which is nice because you don't have to depend on all the different municipalities to all do the same thing. It also would require that the rule be approved by our county commissioners with an ordinance. And there was, early on there were some questions about whether that ordinance covered municipalities, but that was clarified by our Attorney General's office last year. And it basically is the county commissioners confirm the rule by their action, but it still remains a public health rule from the Board of Health, and therefore does apply to those municipalities.
So at this time, this is just a resolution, not a rule, or is it?
This resolution would just go out for support,
For
and I would
support.
bring that back to you at a later date for
Correct.
action on if it's your pleasure to pass such a rule,
Thank you.
once you see whether the support is there
All
or
right.
not.
So at this time, it'll be a resolution to support tobacco-free parks in Pitt County And it, from what you stated, it goes to all the municipalities and Pitt County parks. And we're asking for their support and see where we go with it.
They would sign on to this resolution, and I would collect those and bring them back to the Board of Health.
Thank you. I need a motion to, I need a second.
Second.
I got a motion and a second. Any further discussion for this resolution?
Mr. Chairman, would you like me to read the resolution just for our viewing audience? And it's not something we can project.
Sure.
But they may
Sure, feel free.
appreciate knowing what this
Yeah.
includes. Whereas our parks are established to promote healthy activities and community wellness, especially for children, whereas several parks in Pitt County share facilities with or are located adjacent to public schools, which by law have 100% tobacco-free campuses. Whereas according to the Centers for Disease Control and Prevention, tobacco use and secondhand smoke exposure are leading preventable causes of illness and premature death in Pitt County, in North Carolina, and our nation. Whereas research indicates that during active smoking, outdoor levels of secondhand smoke may be as high as indoor levels and may pose a health risk for people in close proximity to the smoker, and also some hazard to people beyond 30 feet. Whereas children learn by modeling adult behavior and benefit by having positive role models and from positive reinforcement of healthy lifestyles. Whereas cigarette and tobacco litter is the #1 item littered in our parks and creates a health and safety hazard to small children and wildlife and distracts from the natural beauty of the environment. Whereas in 2009, the United States Food and Drug Administration announced that an analysis of electronic cigarettes or e-cigarette samples indicated that the e-cigarettes contain not only nicotine but also detectable levels of known carcinogens and toxic chemicals. Whereas on January 2nd, 2010, an act to prohibit smoking in certain public places and certain places of employment, North Carolina Session Law 2009-27, became effective, authorizing local governments to adopt and enforce ordinances that are more restrictive than state law and that apply in local government buildings, on local government grounds, in local vehicles, or in public places. Whereas the mission of Pitt County Public Health is to protect, promote, and assure the health of all people in Pitt County, and the Board of Health has the authority under North Carolina General Statute 138-39 to adopt rules necessary for that purpose, and these rules apply to the county and all the municipalities within Pitt County. Therefore, be it resolved that X board or council or committee supports the adoption of a public health rule to prohibit use of all tobacco products, including e-cigarettes, in all public parks located within Pitt County.
Okay. Thanks for reading that. We have a motion. We have a second. I'll ask any further discussion. If there's not. Okay, all in favor? Aye. Opposed? Okay, motion passed on the resolution. Item for new business, I think that's you, Dr. Morrow, with the, which one you want to start with, the influenza update?
Influenza update. I need to step to the podium.
Okay.
I just wanted to update folks, there's new data out on influenza. I heard a news story today, actually on the radio, announcing that the deaths in North Carolina have gone up to 74 now. And this is data actually going back, because our meeting was canceled last week. This data goes back really to February the 1st, so it's 2 weeks old. But I can tell you what's happened since then is that the trend is continuing to decrease, which is good news. You can see on this first slide here, this shows the last 3 years of influenza-like illness. I'll just remind people that we don't do surveillance. We do surveillance on influenza, but it's not like we do on some other diseases. They're not required to be reported. So cases of influenza, a doctor does not report those to us necessarily. So we depend on different systems to actually do surveillance on influenza in North Carolina. But we do have, I think, a very good system here in this state, and so we're fortunate in that regard. But this is 3 years of influenza-like illness going back to 2011, 2012. That blue line at the bottom is that year. You can see it was pretty flat. Never even got over 2% of influenza-like illness. Now that percentage is the number of patients that are coming into certain places across the state. The percent of patients who come in for a visit to those offices that have influenza symptoms. So these are not positive cases necessarily, but influenza symptoms. But this has been very accurate over the years that we've been using this. The last, I guess, about 10 years we've been doing this. And we're fortunate here in Pitt County because we have 4 influenza-like illness surveillance sites right here in the county. Our health department is one of those, as well as East Carolina University and some of the clinics at the med school. So you can see that last year, the black line is 2012, 2013. We had quite a peak in January, and then it fell off pretty rapidly in February. We had a similar rise in late December of this year. The red line is this year's influenza-like illness. And we got up to just under 5%. And then since then it's dropped down. It went back up a little bit at the end of January, but the last couple of weeks has continued to decline. So that is good news. The next slide here shows the positive test reporting from the Public Health Laboratory in Raleigh. So there are also specimens that are being collected across the state. This is not the typical tests that are done in a physician's office or even an emergency room. These are special viral tests that are really just better. A lot of doctors' offices use a rapid test that is not quite as sensitive or specific to influenza, but sometimes is helpful with taking care of patients. But these are actually tests that are done at our state public health laboratory for influenza, and you can see that those numbers have gone up and down and up a good bit again at the end of January. But the important thing here I wanted to show you that is this is the types of flu that are identified. The green is type B. The red is an H3 influenza. The yellow is a type A influenza that it's not subtype, so all you know is that it's some type of type A. Type A's are the ones that generally cause the big outbreaks or pandemics that we worry about. But you can see from this that the vast majority of all these samples that have been collected are H1N1, and that is a type A influenza. That's the one that came out in 2009. That's the one that's been included in our vaccine for the last 4 years. But there was a really strong dominance of H1N1 for influenza this year, and is the one that's being held responsible for the deaths of the 74 North Carolinians. And that's my last slide here that I did want to show you how how those deaths have been spread out. Now, this was before the last count, so I think this one was 62, if I'm not mistaken. And these numbers will change from week to week because the investigation of the deaths sometimes takes several weeks. So that you can see these numbers jump up, even though we may have only had, say, 3 deaths in a week. The number may jump up by 6 or 7 because they've gone back farther and found some of these other deaths farther back. So, but the important thing I think to look at here is that the majority of these deaths are between 25 and 64 years of age, which is a little bit untypical of most influenza outbreaks that we see, where we usually think about the elderly or the very young being the most susceptible. This does not go along with that pattern. it is a little reassuring. The state tells us that the majority of these folks who have died in this middle age, if you will, have had significant risk factors. Although that's not totally true. So I think there are a few cases in here of people who just got very sick with influenza and died, and did not have other risk factors that caused that. So we'll know more about those deaths as these investigations proceed. But I thought our public.
Dr. Morrow, is this typical in the
look at
past? I mean, from research, is it this age group, or has it been more from the younger to the elderly, or is it just?
It typically is elderly and young. That's what I'm saying in most influenza A outbreaks. But in 2009, when H1N1 first presented, you may remember there were a lot of deaths, particularly among pregnant women. We're seeing deaths again among pregnant women and among obese patients in this middle age range.
So you see this trend staying like this for some time, or you don't?
That's a great question. I'm not sure I have the answer to that. I don't know if Dr. Ramsey would try to answer that, but I think as with any influenza virus, you've got the immunity starting to build. So we've been vaccinating the population in the United States now for 4 years. More people have been exposed to the virus. So you would hope that you would see more immunity and therefore fewer deaths as if the virus doesn't change. That's the thing about influenza, is the virus is constantly changing. So, we probably won't see the number of deaths continue like this with H1N1 because more and more of the population would become immune, except your newborns. But the chances are is that we'll see the evolution of a new virus also. That's always the potential.
Thank you.
Mr. Chairman, if I could comment, as Dr. Morrow mentioned, each flu season is unique, and this particular strain, for whatever reason, does tend to cause more severe disease in what we would consider healthy people. There were some college students, for example, during that first year who passed away who, had no risk factors at all, no asthma, no diabetes, no HIV or anything else. So certainly would make a pitch that it's still not too late to get your flu shot this year. Flu season typically goes through April 1st, and so some of these folks, both who have had severe disease at Vidant Medical Center and those that have died around the state, some of those were unimmunized. They had not had the benefit of getting the vaccine. So if you haven't gotten your flu vaccine, there's still time. Go get your flu shot, and it will. You'll have immunity within 10 to 14 days. It may totally prevent you from having a case, or if you do get a case, it may be a lot milder than you would have had otherwise. So, again, not too late to get your flu shot.
Good advice.
Thank you.
Thank you, Dr. Ramsey.
Go ahead.
Yeah.
Sorry.
That's all I had on flu. If you'd like, Mr. Chairman, I'll move on to the next.
Go right ahead.
Healthy workplace. I did want to mention we had a planned visit from the State Secretary of Health and Human Services, Dr. Aldana Voss. She had planned to be here last week. Well, it was 2 weeks ago now, wasn't it?
Yes.
Skipped it with the weather, all the weather we've had past few days, but it was about 10 days ago on the 7th. She had planned to be here. Now that was last week. Oh,
It was
10
about
days
10 days ago.
Thank you. This is the 18th, so it was on the 7th that she
Yeah.
had planned to be here. That was also the day that Give Kids a Smile also occurred in the county. So the governor was here that day. You remember Secretary Voss had to cancel at the last minute. But she has been visiting other health departments across the state. And she does plan to reschedule her visit here to Pitt County. And I hope that'll be soon. But one of the things that Secretary Voss is very concerned about is the environments and the workplace environments that public health projects. I think our health department does does a pretty good job, particularly in our lobby and some of those other areas. We're trying to educate people wherever they are in the building. I think one of the areas that I see a concern with, and one of the things, frankly, I was concerned about Secretary Vosh's visit because I'd heard from her other visits to health departments in the state. They were criticized for not having healthy enough environments for their staff. It's one thing to have healthy environment for the patients and for the clients, but one of the things I think we don't do as good a job with is for the staff. And we have vending machines in our lounge, and that was one of the topics she pointed out at other health departments across the state, that we need to be not just talking the talk, but walking the walk. And so I'm interested in trying to replace our vending machines in the health department with healthier options of food. We've tried some healthy vending options in the past. It wasn't successful, but we have had discussions, and Robin High, who's getting ready to come up now and talk about another nutrition project that we're doing at the health department. Robin and some of the other nutrition partners in the county have talked about this on a broader scope. We're interested in not just a healthy workplace at the health department, but in all workplaces in our county, because people who live in this county and work in this county, a lot of what they do is at work. So we want to make sure that people have healthy workplaces wherever they work. But again, I think it's very important that our public health department sets the example for others to follow. And so I want to pursue whatever we can do in the health department to give a good example, not just to our community, but to our staff internally also. So I plan to do that, and I just wanted to make you aware of that. If it's all right, Mr. Chairman, now I'd like to bring Robin up to talk about a project that Secretary Vosh actually created this project, if you will. And we were fortunate enough to be one of two of the counties in the state that she picked to try to do this What's on My Plate project. And I'll let Robin tell you about that.
Good evening. As Dr. Morrow mentioned, one of the new programs that we're working on now is What's on My Plate. It's very exciting. As he mentioned, health and environment is very important. And I've talked to you all about this before, as we do in the community, but we still have issues with overweight and obesity in the pediatric population. And this was one of the purposes of this program, What's on My Plate. According to North Carolina State Center for Health Statistics, around 29% of children are overweight or obese in Pitt County. The good news is it's improved some. However, there has been a decrease from 2010, when the percent was about 35%, and now, a little bit difference in the year, but 2012, the percent was 29%. So we've had some decrease, which is good. So 35% respectively to 29%. So 2010 to 2012. So some of that, we have seen some improvement.
And Robin, that's in children 2 to 4, is that correct?
That's correct, in children 2 to 4 years old. I may have just lost the video here. Oh, there we go. Okay, so some of the objectives of the program are to educate families on healthy eating and reinforce those positive eating behaviors for 2 to 4 year olds, and promote family meals. So we talk a lot about that with our WIC program anyway, but this program has a special focus for peer-to-peer influence. So the messages are really the same things that we talk about day to day. These are the messages that we communicate to the community. These are the messages that we communicate through WIC. Eat more meals at home. Make half of your grains whole. Make the switch to fat-free or lower-fat milk. make half of your plate fruits and vegetables. And really, we're introducing this program as a fun program. So families who like to cook or even want to learn more about healthy recipes can participate. So how are we doing this? How is the WIC staff recruiting for what's on my plate? So we explain the information to our participants. Again, it targets 2 to 4 year olds. You do need a smartphone. One of the necessities is a smartphone. The recruitment's being done at certifications, WIC certifications, recertifications, and at some of our mini food tastings that we have, which I'll talk about in just a bit. Posters are at each WIC window. For example, if a person's not scheduled to see the nutritionist that day and they're just picking up their food instruments or vouchers, then they can also inquire about the program and get more information at that time. We began in January 2014 and will continue to March 2014. So even if our participants don't fall into the 2 to 4 year old categories and they're interested in getting more of those recipes or learning more about healthy cooking, we're still, helping those participants and letting them participate. And we have had some of those situations occur. So really, we're not telling anybody, no, you can't participate. We're really encouraging people to participate, even if they're not 2 to 4 year old families. So our nutrition team explains the topics, the recipe choices, which I'll explain just a little bit more in my next slide. Recipe preparation and how to get the children involved. For example, let them mix foods or measure ingredients. And the application of the smartphone feature. At the next visit, which is the follow-up visit, the participant brings the phone back and their photo. Well, basically, the photo is downloaded, and we print it, and the participant gives feedback. So what we do with this feedback is then put it on a bulletin board in our lobby, and that's where the peer-to-peer influence comes in, because the participant may write something such as, really fun for the family, was easy to make, whatever they felt about the recipe, really tastes great, something like that. So they get to participate by also writing a message on that board. So I mentioned the topics, and I mentioned low-fat, fat-free milk, whole grains, fruits and vegetables. For each of these, the participant can choose to focus on breakfast, lunch, or dinner, or snacks. And these educational messages are based off of the Eat Smart, Move More program, and they're based off of USDA messages. So all, again, consistent with the messages that you hear day to day. And consistency, we find, is really important for our public and getting those correct messages out. So just to let you know a little bit about enrolling participants and follow-up. So the client, like I mentioned, enrolls with the nutritionist. They select their nutrition message. They select which meal and or snack they want that they're interested in. The client returns in 2 to 3 months, and they'll see a nutritionist. And then the nutritionist will, again, download the photo, but they'll also do some outcomes. So they'll ask the client, did they try the recipe? Was the recipe easy to use? Is the family eating at home more, which is one of the goals? And would the client like more healthy recipes? So getting the word out, how are we promoting this? How are we telling people about this? Well, we're doing it in lots of different ways, not just in the health department. We did feature this on WITN TV Growing Up Fit program, which is a monthly segments that occurs. The last one we did, you might think that something as simple as cheese toast can be helpful, but what we featured, and it was actually very good, that's an actual picture that you see on the screen. We provided tips on healthier versions of traditional cheese toast, so it was lower in fat, it was higher in fiber, and it had more vitamins and minerals. And you can really mix this up. You can get more vegetables in your daily meal plan. We give other tips too. So we mentioned this one because you can get tomatoes and low-fat cheese and whole grain. So you're getting whole grain, you're getting tomato, and you're getting low-fat cheese. But on this programming, we also give alternatives to other ways to do this too. And I just wanted to highlight some of our employees and some of the things that we have done. As I mentioned to you, we do have many food samplings every quarterly generally, at which time we feature some of these recipes. So this is just a picture of one of our dietitians and one of our clerical staff who's helping to make caterpillars with grapes and ladybugs with, I believe, I'm blanking here, tomato ladybugs. So we do these, and really it's nice because our staff has been doing this the whole time. We've been doing these mini tastings and, you know, exposing our WIC clientele to the not only just the WIC foods, but what to do with the WIC foods. And so now, hopefully, with this program, it's the next step, and we'll have some outcome data too. So again, we get our staff involved. We had some ECU students helping out. As you can see, some of the behind the scenes here. So we get our staff involved. That's one of our staff members up front. We get other staff members involved, not just our WIC staff, but our health department staff too, and students. And we've got upcoming Facebook, so we'll have that promoted as well. So just to kind of, in summary, fix a healthy meal or snack for your family, take a picture of it, share the picture, make a difference. For more information, certainly you can call your WIC office or our WIC office, 902-2393 or 902-2388.
Thank you, Robin.
Do you all have any questions that I can answer?
No, that's very, but you're saying it goes not just for 2 and 4-year-olds, you're doing it for any group?
The data that we'll report to the state when we complete the pilot will be for the 2 to 4-year-olds, but we're also, you know, opening up for anyone.
Okay.
Exactly right. If they're interested, then we are opening up for anyone.
Great. Thank you, Robin.
You're welcome.
Do you have any more items on your health director's report? Or?
Just one, Mr. Chairman. I did want to report on the Give Kids a Smile Day that did happen on February the 7th. It was very successful. As most people heard, the governor came into town for that, and that was really exciting. But it was a little different this year. This was the 12th annual event, and you know, the credit really goes out to our dentists in this community. We have just an amazing group of dentists who volunteer to do this each year. They had 26 dentists this year. They had 226 volunteers at this event. They treated 107 children with a total of over $53,000 worth of free care they provided. It was the East Central Dental Society and the private dentist here in Pitt County who organized this, along with the schools of dentistry and medicine from East Carolina University, Department of Pediatrics, particularly the College of Nursing was there. It was, as always has been held at Dr. Jasper Lewis and Lee Lewis's office at Eastern Orthodontics and Pediatric Dentistry. They broadened it this year to include other services for children besides just dental care, and that's why the med school was there doing blood pressures, weights, height, body mass indexes. Our health department was there with information on WIC, also our positive parenting program, information for parents on that, and we are also assessing immunization status for those children that came in and found a few that needed their immunizations updated, and we're working on that today. So overall, it was just a really very successful 12th year event. I think, you know, the question I think is, as this thing gets bigger and bigger, it seems to every year, I think we're about to run out of space over there. So they're already having some discussions about whether or not there's an opportunity to do it someplace else. But
Will we be able to bring our mobile unit over there? Or?
Well, our mobile unit staff usually works this.
Okay.
But no, we haven't brought the mobile unit in, and that probably would be difficult. They've got a lot of chairs. They just run out of physical space. But, yeah, our staff typically volunteer for this, including our interpreters that have worked this event also. But we really want to broaden it to other services for children. And I think when you look across the state, this is probably the most successful model of this that's happening. And it's, again, it's because of our dentists. They just do a super job at making this happen. So hats off to them.
Any other items?
That's all I have, Mr. Chairman.
Okay, think we've covered everything. I was going back through. Yep. We've got everything. I appreciate
Next
it.
meeting would be March the 11th, I believe. Is
March
that
the
right?
11th, but that's not televised, correct?
That's correct, be a non-televised meeting.
Correct. That's it. I need a motion to adjourn. I got a motion. I need a second. Second. All in favor to adjourn? Aye. Opposed? Thank you.